Hello, friends. So just want to give you everybody heads up. I would like to say that I'm recovering from COVID, but I'm definitely making good progress. But I had a definitely a I am not doing too great today. I think I was just doing too many things yesterday, and that's resulted in me getting a fever and all that kind of good stuff. So, but the good news is that today I'm not going to be the one talking. I did not want to cancel our appointment with you today because I want to talk about thermography. This whole 2 weeks we're talking about breast health. We're talking about happy sisters, different herbs, different oils that can support your breast health, and so with that always comes the question about how do I get diagnostics under, get a good understanding of diagnostics. What are my options? And is mammogram the only way to go? And so on and so forth. And so I did not want to delay that conversation. And we had that in the books already for a few months. So want to just honor that and deliver that good news. I'm not going to be the one talking. So, and so who will be? And some of you may know Gay Walden already. Hi, Gay.
Hello, everyone.
Gay has been with us, and you guys loved her presentation. I think it was like over a year ago that we had her on, and people still laugh about your fluffing boobies, and we can talk about fluffing later. But yeah, so really in today's call, what I want to cover is just to create the awareness that thermography is really not a replacement for a mammogram. It is a completely different purpose of doing it. So those are not interchangeable. It is not one or the other, and you will see from today's presentation why that is so. You're also going to see my scan when I went to see, when I went to see Gay last summer. She's in Charlotte in North Carolina. I had another thermogram done, and so we're going to be sharing with you my results of my thermogram, and then we're going to be talking about some really interesting cases of what has helped women that she works with improve, or actually some things that have made their breast health feel a lot worse. Before I hand it over to you, Gay, I just want to acknowledge and the fact that the whole idea of happy sisters, and you guys, some of you already familiar with that, came actually when I connected with Gay like about 2 years ago or so.
Right.
And the whole idea about doing lymphatic massage and coming up with a product, like especially the cream, and well, Procreate as an herbalist, I already known this all along, but and to apply the cream in a way that massages your breast and opens up the lymphatic system in the breast. That's actually something I've learned from Gay and the instructions that it comes with. And you guys know I've demoed it many times before. So it is really kudos to you, go for that. And, and I just don't really know that many people who are more passionate about breast health and more knowledgeable about breast health than Gay is. So before I lose my voice and get any more fever,
yes,
I would love to hand that over to you. And what we're going to do, the format today is going to be a PowerPoint presentation with a lot of examples and a lot of notes for you to take. And we'll do that for about half an hour. And then we will then post your questions, maybe hold your questions till the end, because then chances are they're already going to be answered. And then we're going to talk about, we're going to do a Q&A with Gay at the end of that half an hour. Okay?
Wonderful. Thank you so much. Yes. Let me do the talking. Let her continue to be on the men, please.
I have my ginger tea here with some lemon and some Manuka honey. So I'm going to be sipping on that while you are, impressing us with your stuff.
That's wonderful. That's what you should be doing. Hello, everyone. I'm very happy to be with Magdalena again. I remember that first interview, and I really enjoyed it. And I'm so happy that those of you who participated in that one got a lot out of it. Based on the calls that I got afterwards, after that interview, I think a lot of people did. So I'm greatly appreciative of your interest in this. I have been doing breast thermography in the Charlotte area for 10 years now. I was trained by Dr. Bruce Rend, and Magdalena has connected with him. He is a pioneer in this. But one component I've added to my service is I am a holistic health coach. So after the imaging is done, I provide a follow-up meeting with that woman to go over all the many things that she can do to affect positive change in this part of her health. I'm going to get right into, some of you may have already seen a thermal image in color, but there are two ways that we look at these images. One is in this rainbow or false color image, which maps temperatures within the breast tissue, with the warmer areas being indicative. If it's not infection or trauma, 9 times out of 10, it is inflammation. Now, the scale on the right-hand side there will show, it really helps us identify these areas within the breast. Black, hot pink, dark blue, light blue, those are the cooler colors, the warmer colors being green, yellow, red, and white. So the neck is always warm, the underarms always warm, where the breasts lay are always warm. But we're looking at the global breast, in and around the global breast, and the nipples and the areola and upper quadrant to see if there are any significant differences in temperatures in one area of the breast that we don't see in the other area of the breast. So color really does help us identify these areas, and we can see visually with using this scale, if there's something going on in one breast that we don't see in another breast. Another way we look at these images is in grayscale. And what the grayscale shows is something we call thermovascularity. These are blood vessel patterns. And most people have a certain amount of blood vessel patterns when we do this imaging. Something usually shows up. But if we do, because blood in the vein is warmer, and that's why you see dark. That's why this points out the vessels. And when you cool the blood in the vein down, these vessels actually disappear. When we see, as I'm pointing out here with my cursor here, branching is what this is called. When one of these branches off, that is called thermovascular branching, and most people have some of that. When it's stable, it's okay, but we do keep an eye on these vessels to see if they're showing any other patterns forming. So this is Magdalena's front image that I took of her this past summer. She has had thermography before, and when she came to me, I asked her about this area that I'm circling in her left, above her left breast, and that's been there. That's part of that's stable because she's done this before, and it's related to structure. And we're going to talk about structure further on in this presentation and how important it is for breast health. Structure enters into every part of health, and it enters into breast health as well because of its impact on lymphatics. Magdalena had a good thermogram with me. She's stable, and that's always a good news to give anyone who comes to see me. It's important that the breasts have look-alike from a color standpoint. This is one that shows excellent symmetry in color, because the right breast looks like the left breast, and that's important. A lot of times, like with Magdalena, she has very high metabolism. I'm certain of it. When we see, I'm showing her image again because the background colors are warmer, but that's also reflective of good metabolism. And when it doesn't look different from her last thermogram, it's stable, and that's always good news, like I said, to give a woman. This one just happens to be almost perfect, and I've only done one that's this perfect. Usually there is something above the global breast, this vascularity. She doesn't have any, but I show you this slide because that's we're looking for symmetry in the colors. And this is an example of extreme asymmetry in the breast. This particular woman had a normal mammogram and a high-risk thermogram, of course. And what does this mean? Well, she had a history of breast cancer. She had just had a normal mammogram, and she imaged with me, and we did find this area here, and you can see the asymmetry in the color. Things don't look alike. What this means for this woman is she doesn't take some proactive steps, lifestyle steps, there's a good chance that the cancer could come back. That's what this means. Thermography is the screening that offers you a forecast. The best way to describe it is, like Dr. Wren does, a weather forecast. If the skies are looking cloudy and dark and a storm is imminent, we can reverse that storm by taking appropriate action. And some of the slides I'm going to be showing you are before and after images of women who have done that. I continue to be passionate about this work because I am continually seeing women who come and have, like this woman in the left here that I'm showing you, who has, you know, a risk of TH4 that I have not explained. We do use a risk assessment rating of a TH1 to a TH5. 1 and 2 is below average, 3 is average, and 4 and 5 are above average based on the criteria that we know can assess the health of the breast based on the American Academy of Thermology's risk assessment ratings. So she was a 4 rather in the right breast and a 3+ in the left breast. And in 5 months, which is good, a record time, she was able, and you can see the better symmetry here on this image, the subsequent image, how the symmetry is much, much better. The breasts look alike from a color standpoint more. And she did, usually it's more than one thing that a woman has done to affect positive change. But I can assure you that one of the things she did was lymphatic therapy. It's very, very important that a woman learn how to do a lymphatic breast massage. And that I know that is one of the things I recommend first of all, because most women, not only do that, they not massage their breast, they do not examine their breast. And Dr. Wren taught me years ago, he said, Gay, the hands-off approach to women's breast health is not working for them. Literally, you have to get in better touch with what the tissue feels like. If you know what the tissue feels like, now, like after this thermogram, the woman most likely went to the breast lymphatic therapist I recommend. She had a breast health education appointment, found out what her tissue feels like, started doing, taking some proactive steps that I had recommended that she do during her follow-up meeting with me. And she was able one day to wake up and say, my tissue feels differently. And it's been 5 months. I think I've made a positive change. And in fact, when she came back, she had made positive change. We can see it. And we did the measurements too to back it up. So this is a perfect example of what lymphatic massage can do. This lady was a TH5 in her left breast. You can see that there's more warmth here because this is in the yellow and the green, and she doesn't have that activity there. The only thing she did in 4 months, she went regularly to this breast lymphatic massage person. She learned how to do it herself, but mostly she went back to this therapist, and she also incorporated cupping, breast cupping, which is a stronger lymphatic. In 4 months, without making any other changes, she went from a TH5 in the left breast to a TH4 in that breast in 4 months, which is record time. And what this is telling the woman is that this works. And if she begins to take on some other things, make some other changes, you can imagine that that 4 will continue to go down the more she decides she can do to, as far as proactive steps. So here is someone who made a change in 3 months, which is record time. I normally do not recommend that a woman come back in 3 months, but this woman was so determined to do all the things, and she practically stopped doing everything else to focus on this. I know that she went to a practitioner who diagnosed her with Epstein-Barr, the Epstein-Barr virus that had come back in her. She had mono years ago. Most of us do have the Epstein-Barr if we had mono. And this practitioner was able to suppress that virus. That, in a strict way of eating, resulted in 3 months, this before and after. And again, you see the better symmetry the subsequent image, the breasts look alike and they're healthier. This is improvement with far infrared therapy. Many of you may know about the benefits of far infrared saunas. In our area, we have somebody who has something that's like a far infrared sauna on steroids. It's called a Photon Genius. I wanted to experiment with it, and I did with this particular woman, an airline pilot who was high risk in both breasts. And I asked her when she was in town one week if she would use this therapy regularly for a week. And I gave her a thermogram before she started using the Photon Genius. And then I gave her a thermogram after 5 days of using it. And she reduced her risk by 1 point in 1 week. And this is very subtle, but you can see the yellow and the red here, can't you? And there's less here. And you can see that the areas here in the global breast have cooled. Pretty remarkable for 1 week. One of the main things I do recommend, in addition to the lymphatic work, is to have the access to an infrared sauna. If you don't have one, find one in your area and use it. We live in such a toxic world that we need to maximize our detox systems as much as possible. And obviously perspiration does that, but the Photon Genius and the far infrared saunas go to the cellular level to heal the body. This is what her images look like in black and white. You see the vein at this thermovascularity is pretty extreme in her breast. And again, it's very subtle. It's lightened there, so you can see that it has improved even in the black and white images. Pretty remarkable. So this is a lifestyle thing that many of you may be familiar with, something called Spanx. You can get them in lingerie stores and department stores. And they kind of compress areas where you have maybe a little bit more fat than you like to make you look better in clothing. I think that's why Spanx was invented. Anyway, this woman had, this was her second thermogram. And the first one that she had was very good. And when she came back for this one that's portrayed in the left image, I thought, oh my gosh, what has changed? What's different? And she proceeded to tell me that the only thing she had changed, every day she wore this Spanx underneath her breast. So I said, please, please, please stop doing that. And when she did and came back the following year, her breast and her thermogram was much, much better. I mean, she went back to what her first one looked like. So this is a lifestyle thing. And sometimes people, rather than go to the effort to eat healthy and lose weight, and appearance is important, but if anything that restricts the rib cage is restricting lymphatic flow in the breast tissue, and that's what Spanx did for her. Speaking of structure again, this is someone who, yes, has some structural imbalance. Everyone has a certain amount of it. And in these images, I see slight structural imbalance. Sometimes I see extreme structural imbalance like this. And we know when that exists, that can negatively impact lymphatic flow in the breast tissue. This is Dr. Wren's diagram. Poor rib breathing motion means poor lymphatic drainage in the breast. And it's a very important part of this. And he is able to do an osteopathic technique in his office that can immediately show results in the thermogram. When he does this technique and cools a woman down. It's pretty remarkable. So I have gotten him to Charlotte on many occasions and have educated, and he has educated rather, a couple of chiropractors to whom I send my clients when I know that structural imbalance is a huge part of why their lymphatic system in the breast is not working the way that it should. So here is something that is a term that if you're following Magdalena, you should know this term, estrogen dominance. And she has focused on this and has written the best book about estrogen dominance that's out there, in my opinion. And I strongly urge the women who come to me to read more about it and learn about it. But this image on the right, on the left rather, from 2017, this particular woman, you see the leopard-like appearance in the black and white. Whenever we see this, and there's a certain amount shown in the black and white images with every woman, when we see it this extreme, and this is very extreme, the first thing I asked her is, what are you doing? What are you eating? What are you taking? She had said, oh, I just picked up a new supplement at this health food store, and I don't know what's in it. I said, well, you go home and you call me and tell me what is in it. And first ingredient was soy. I said, please, please, please stop taking that supplement. And she came back for one in 2018, and she had made some slight improvement by not taking this supplement. But from 2018 to 2019, she did acupuncture, which also helped her balance her hormones in addition to what else she was doing. And this is what resulted. That leopard-like appearance obviously went away, reflective of her balance of her hormones.
Right. Can we go back to that image in a second?
Now?
Yeah.
Okay.
So this, because a lot of people are asking, we'll get to the questions, you guys, temporarily, but momentarily. But as we are going through this, a lot of people already have scheduled their appointments and stuff like that. I think one of the things that the purpose of this presentation today is also for you to understand what is a good quality thermography. I think thermography has received, unfortunately, quite negative reviews for various reasons, and many of those reasons are actually correct. If you're going into a center that does Botox, and by the way, you can also get a thermogram done, most likely that's not going to be a high quality thermography. So one of the things that you want to look for when you actually, why don't we talk about that a little bit, Gabe, before we proceed on? Like, what are the kind of questions a person want to ask while scheduling an appointment with a thermographer in their area?
Yes,
right. And because I know, like, the black and white is one of the important things that your thermographer wants to say. Yes, we do grayscale analysis as well, and if they don't, then you probably want to walk away and call somebody else. Do you want to just give us maybe a couple of points?
Sure. Yes, we can go back to the rest of the presentation, but that's a good point, because not a lot of people in this country offer thermography. And the thermography centers that are around the country, there's certain ones that kind of set a thermographer up in business, meaning you get the camera, the interpretation service, the training, all in one package. I was fortunate that one doctor trained me, and I didn't go that route, but most of the thermography centers around the country, that is the case. So you really have to, the camera is important. The cameras today are very sensitive my camera is sensitive to 1/10 of a degree. They're making thermal cameras whose resolution is even better, but resolution doesn't matter as much as sensitivity. So just make sure that the camera has this kind of sensitivity. And we're not trying to see what you look like in these images. We're trying to get the best sensitivity so we can keep up with these temperatures and these temperature differences.
So what kind of, when you say sensitivity, so let's say somebody's calling to fix an appointment tomorrow, right? Mm-hmm. What kind of sensitivity should we be asking about?
For the camera?
Yeah.
Okay. That's something that I can give to you to share with your audience, but I don't have that right in front of me as far as the minimum or the maximum kind of thing. But most cameras nowadays are sensitive to 1/10 of a degree.
1/10 of a degree.
Yeah, okay. 1/10 of a degree. And they measure it in pixels, and I don't have it off the top of my head what the pixels should be. And the pixels tell the sensitivity. And if you really want to impress somebody, yes, know what you're looking for as far as the pixels, and you could even ask that question. But if you ask, what's the sensitivity of the camera, that's more important than anything. So I can get you those pixel numbers, and you can share it, because that is a good question to ask. But not every thermographer is going to show the images in grayscale. And like Magdalena said, that's very important. Not every thermographer is going to give you information after the imaging too. And you want as much information and education about this as possible. You want to know who the interpreters are, how are they qualified to read them. you want to hopefully see a sample of the report to see what you're getting, if you can. And most of all, a referral from someone who's been to this center and had good experience. They're good thermographers out there. They follow a system, and every system of interpretation is different. If they follow the guidelines of the American Academy of Thermology, that's a good sign and a good criteria to determine if you need to go there or you should go there.
Mm-hmm.
Is that good, Magdalena?
Yeah, I think so. Yeah. And, it's go also with your intuition. I mean, I think there is the first thermogram that I got done was here in Boulder, Colorado. And, when I go onto the website of this practitioner, I mean, it was pretty clear that is her entire life's mission is about breast health. And it's all about, and she shows examples, there is photography, there is analysis, there is lifestyle recommendations. She talks about diet, she talks about herbs, just structural changes, right? Stress, lack of sleep, how coffee impacts your breast. I mean, and estrogen dominance, right? Like, and so on and so forth. So it's a bit like, when you go on the website, right away that this person's life is revolves around that, right? And so it's most likely that person you're gonna get a lot better service from a kind of place versus a place, like I said, that does Botox and, by the way, a thermogram, right? And you never get a follow-up. And there's so many of you here are commenting in your, on online right now, like how you just got your results and never heard back from anyone. I mean, that shouldn't be the case, right? That defeats the whole purpose. Like, what did you pay for? And most importantly, what does that mean to your health? It's like leaving somebody hanging, it's just.
That is correct.
Yeah.
Every woman should know about this and should be educated about this. And when you get a report from a center and there are medicalese words used, you don't know what it means. And I think you should go to someone who puts in layman's terms, makes you understand it, so you can know how to use it. And it's best used as a risk assessment tool to give you a forecast that will incent you to make changes to make it better. That's the best way I can describe it in a nutshell, Magdalena.
I actually just found the pixel thing you talked about, you guys. I actually just pulled it.
Good. Pull it up.
From Dr. Wynn's article that I did with him, interview I did. So it's basically, so I'm posting it here, you guys. So it's basically, we're looking at detector in the 320 by 240 pixel range.
Right.
That's the minimum, right? So when you call them up, you want us to make sure that this is at the minimum and nothing below that. Okay, cool.
Very good. We got that answer. That's wonderful. Thank you for stopping. That's a very good question for all of you out there living in different parts of this country and seeking someone who knows about this. So I leave this before and after slide to the last before and after slide because it's so important. And this lady who came to me had a very good thermogram, and her first one was in August of 2016 now. And you can see good symmetry. Overall, very good thermogram, TH3 and a TH in the right breast, TH2 in the left breast. She told me during the follow-up, she says, "Gay, I'm whole food plant-based, but we're not picky about organic." Well, between 2016 and March of 2018, she had, this is what her thermogram looked like. Absolutely. This is the image I showed you earlier of perfect symmetry. Well, she and her family went all organic. And so if you think organic doesn't matter, think again, it does. And again, it's because of the toxins in the foods, the processed foods and so forth. They accumulate in the tissue and create lymphatic congestion. And that's why things like infrared therapy and massage therapy that move those toxins out of the body, why those things are so critical. All right, here's it. Okay, we are picking up too, and I haven't said this yet. We're picking up physiological changes. When you do the other screenings, they're looking for a structure, for lack of, I don't even like to use the word LUMP. To me, it's a dirty word, but they're trying to pick up a structure. What thermography does is we pick up physiological changes years before the tissue changes to form anything. And that's the whole idea. And most breast disease, it takes 6 8 to 10 years rather, 8 to 10 years before structure forms in the human breast. So if we can pick up in that time period indications of inflammation and the tissue changing, going in the wrong direction, and you can take steps to reverse it, that's pretty powerful.
Which is what mammogram does not show, right? And that is the whole point, is
Correct.
that it's and so, you know, for sometimes we get these very angry emails from us, from people, or messages saying, you know, you recommending thermography and then you're hurting women for not recommending mammograms, right? And you know, and it's very myopic, unfortunately, and that's obviously the indoctrination of our allopathic medicine, of how we've been taught to see a mammogram. But I just need you guys to understand that a mammogram, when a mammogram is showing irregularity, you already have a problem. Right. And that is not what we are here for. You know, my whole mission in life is to help you thrive in your life so that you never find anything on your breast. Your breasts are in the best health possible. And as Gay said, it takes 8 to 10 years for the breast to experience changes, and whether it's hormonal, or it's blood sugar imbalance, is lack of sleep, it's your high toxicity, you're drinking too much coffee, non-organic food, whatever is the element. Some of it could be genetics, you know, that are activated by all of those things, right? A mammogram is not going to show you early in the game that something is brewing here, but a thermogram can. And so it is completely not comparable to each other. So that's what Gay means, is that the structural change means like there's already inflammation, there's already change in the DNA tissue of the breast. That's a structural change. Mm-hmm. You know, you do not see DNA damage on a mammogram. What you see, right, is you know, when you do see something on a mammogram, then it's like, oh shit. And it is very late in the game, and that's when a whole panic starts, right? And then they, you know, and then you have to deal with the institution of what to do with this and all of that, right? Correct. Act on it way, way, way earlier when you can, and make the changes so that you don't ever have to worry about what the result of a mammogram is.
Right. And this is something I'm going to say, because this kind of sums up what you're saying. Early detection is what is promoted as prevention in this country. Early detection is not prevention. Just remember that. Early detection is not prevention. We're trying to prevent it by giving you clues through the images that either things are going in the right direction or they're not. And if they're not going in the right direction, we want to incent you to make changes to reverse it so that it doesn't show up in any screening ever. That's the whole idea of this. And that the slide that I'm showing you right now shows the various screenings that are available to women. And, you know, Dr. Wynn taught me this. They all have their place, Gay. None of these replace each other. In an ideal world, all of them would be included. You know, practitioners would order all of them to give them the best thorough picture of what's going on, but we do not live in that world. So here is the mammogram. Here is the MRI. Here is ultrasound. It picks up fluid-filled cysts versus those more solid. That's the purpose of an ultrasound. And the tomosynthesis is this 3D mammography, which a lot of women are having, since 50% of all women have dense breast tissue. That's what they're getting, and insurance is covering it for even women without dense breast tissue now, from what I understand, which they are taking more images of the breast to slice through what this dense breast tissue that 50% of the women have. And this visual shows you that in this is dense breast. What they're looking for in a mammogram is white. How do you find something white in a white background? Now, a woman who has fatty tissue, they can easily pick up something. So this is a huge issue in women's breast health, since so many women have dense breast. And, you know, there's a lot of information out there that says dense breast tissue is a risk factor for breast disease. That's hard. If you're relying on mammography only, obviously, dense breast, it's an issue, because they can't see what they're looking for. Here is, this is not from my camera, and I've never seen anything like this, but I have it up here because inflammatory breast disease, unfortunately, is on the rise, and it doesn't show up as something you feel in the tissue. It shows up as a rash. It has some more visual signs, but not necessarily a cyst-like feeling at all in the breast that you can feel. So this is disturbing because this is happening in the younger women, the 20 to 39-year-olds. And if you can pick up a rash or inflammation in the breast, thermography can help with that. But this is something that unfortunately is on the rise and disturbs me, and that's why I want to get this imaging to more to younger and younger women who have the most to benefit. And I'm just going to, there are protocols that you need to follow. And this is another thing, Magdalena, about choosing a thermography center, what to look for. If they don't have procedures for you to prepare for the imaging, meaning cooling your body down by following certain protocols, then that is not a center you want to go to, because you need to acclimate the body by following these protocols, which I ask people to do to cool the body down. And when you get here, you're further acclimated, cool down in a temperature control room at 68 degrees. The imaging itself takes 5 minutes. And this is my thermography room. After the images are taken, it takes about a week to generate a report. And I follow up with the woman and go over the report and discuss many of these lifestyle things that I'm sharing with you today. But it's simple procedure. You're just a little chilly for about 20 minutes. So thermography is effective for women of all ages, and particularly dense breast. Women with implants come to me all the time. It's a great screening for women with implants. A lot of women with implants don't want to do mammography because it compresses that implant, contributing to that implant wearing down in the tissue, which is an issue. Obviously, any kind of surgery after surgery, and she's healed, that's a good way. Breast reductions, even women who are going through conventional treatment, if they want to do a thermogram before and after treatment, they can monitor to see if what they're doing is working. It's safe for pregnant and breastfeeding women, but we can't give an accurate risk assessment for women in those categories. But if a pregnant or breastfeeding woman has an issue, obviously I'm going to image her to see if there's anything that correlates with what she's feeling and try to direct her. But I ask her after 6 months of breastfeeding, after she's pregnant and she stops breastfeeding, 6 months after that, that's when she can come in and get an accurate assessment of the health of her breast, which I recommend because breastfeeding itself can create some issues within the tissue. And it's good to, after stopping breastfeeding, to start thermography and keep up with it. So, the benefits, why most people want to do this is because of the radiation from mammograms. And that's pure and simple a fact. And it's not one mammogram that hurts a woman. It's over time. If she starts at 40 and goes to 70 and has a mammogram once a year and even is called back more, it's cumulative radiation in the body that I think women are concerned about and should be. Other countries do not recommend routine mammography for their female population. The country of Switzerland does not recommend routine mammography because they believe that the risk outweigh the benefits. And even in this country, most of the organizations who set the guidelines for mammography do not suggest that a woman at 70 have mammography anymore. Again, because the risk outweigh the benefits. It's the accumulation of radiation over the years in the body that actually promotes disease. So again, there's no radiation, no compression, and that also leads women to thermography because that compression I have imaged women who've been harmed by a mammogram because of the compression. So, and it shows up in a thermal image after the mammogram that, the tissue has been compromised because of the compression. So, this is a proactive approach. And believe me, it works if you use it the way it's supposed to be used as a risk assessment screening to give you a heads up, give you that forecast. And if the forecast is not going in the direction we want, take these proactive steps, some of which are very simple, and we can reverse it. And I see it every day. And this is why I continue to do this work and am passionate about getting it in the hands of as many women as possible. All right, Magdalena.
I forgot, I muted myself. How do people, before we open it up to Q&As,
Yes.
Pop your questions in the comments, you guys, and then I'll just show the question and we get to it. How do people work with you? What are the options? Not everybody is in North Carolina. Some people would be willing to travel, others wouldn't. So what are the options?
Okay. Obviously, I offer a fully interpreted thermogram for anyone that wants to, from other parts of the country, who wants to come here and do this with me. Obviously, that's not possible for everyone, but I do have some women from all over the country coming here. I offer a breast health consultation for those women out there who go to a thermography center and are not given any follow-up information. I offer that on my website, a breast health consultation, where I can look at the images that you provide me from this other center and somewhat get an idea. And with the information you provide me with, we can still go over all the many proactive steps that I advise my clients who do this with me. I will go through the same type of information that I go over with my own clients with you. When you provide me with information about, show me the images, we can still tell a lot, even though it's not from my camera. And of course, these things that I share with every woman is something, I want to get out there to women that they're not getting from other places.
People are asking, what is your website? So it's holisticbreasthealth.com. And I've just posted that as a link, you guys, on both on YouTube and on our Facebook pages.
Yes, and I do have, after your interview, Magdalena, with me, the initial interview, I did have people calling, and I did have a few people coming here. So, it's unfortunate that all centers don't offer this kind of follow-up information, which I think is more valuable than anything. Knowing what to do with the information derived from a thermogram. That's critical. And so,
so Gay is in Charlotte, actually. Dee is asking where in North Carolina. So Charlotte, so that's perfect. You guys are in the same city.
Yes. Now, one thing, my breast lymphatic therapist, when I say she has a separate business, Magdalena, but I refer all of my clients to go to someone Dr. Wren trained, okay? He believes in this massage of the breast so much because as he said to me, the hands-off approach to women's breast health is not working. They've got to learn to do this, and they've got to do it on their own. So since I'm not licensed to touch, I refer to a couple of women here are trained to give you a breast health education and teach you what's in your breast tissue. And the beauty of this, I am opening a new office and screening on Fridays in the office where this therapist is also practicing. Awesome. So literally someone can come from out of town, do a thermogram with me, and go 2 steps down the hallway to someone, if the appointment is made in advance, and get this breast health education, which I think is an incredible thing.
Yeah.
I'm training a young mother to use the other camera that I have, someone that's been working with me, and I'm there on Fridays training her. And literally, we've had people who find out about this come to do a thermogram and then walk 2 steps down the hallway, get a breast health education. I can't think of a better thing if women are concerned about this part of their health and they want to get on this bandwagon. We created this without even planning it, and some of the best things that happen in life are not planned. I believe that. Truly. But
okay, Julie has a question. I had a thermogram done and the expert doctor couldn't tell the difference between dense breast tissue or grade 4 cancer. No follow-up. How hard is it to differentiate between cancer and dense tissue?
That involves radiation, and we don't have any radiation with this.
But she said she had a thermogram.
You can't tell breast density in a thermogram. There's
Right.
no way to tell density in the breast with a thermogram.
Right.
Only, unfortunately, it's only a mammogram that can give you your category of density. And the radiologists follow 4 visuals. 2 that are less dense than heterogeneously dense and extremely dense. And if you're deemed heterogeneously dense or extremely dense after a mammogram, then that telling you is that they can't see what they're looking for, that this is not truly effective for you.
So speaking theoretically, like Julie here, let's say a healthy person with dense breast tissue and healthy breast would have what kind of a thermogram versus a woman who's got stage 4 cancer? What kind of what would her thermogram look like?
What would a woman with dense tissue look like versus one with known cancer diagnosis?
Healthy but dense breast, yeah, versus stage 4 cancer.
Well, since we can't see breast density in a thermogram, hopefully that person's going to have much help. And what it's going to look like is she's going to have better symmetry in the color. And the person with a diagnosed cancer is going to look more like, let me see if I can go to a slide that would, show you this. And I think early on when I was showing you asymmetries is probably a good one to show. Because this woman did have at one point a known cancer diagnosis, and she had treatment and so forth, and she was following her breast health with mammography, and she had a normal mammogram, and then followed by this high-risk thermogram. So it does take a while for the tissue to change for them to pick it up in the mammogram. As I said earlier about this particular image, her breasts are not symmetrical. Her breasts are not healthy. This area here, it's not showing up in a mammogram, but it's showing up in a thermogram as high risk. And if she doesn't make the necessary changes in lifestyle, there's a good chance when she goes for another mammogram, it will show up. But
that's it's almost like, I mean, reading this comment from Julie, it almost makes me think like this doctor was completely not trained in thermography.
Doesn't sound like you can't pick up density in a thermogram.
Yeah. Anyway, yeah. Okay.
So it's unfortunate that women cannot definitively know what their tissue is like, whether it's dense or not, without having a mammogram, Magdalena. That's, maybe you can, if it's more fibrous and glandular, that's dense tissue. And I guess a woman can feel if there's less fat and more fibrous glandular tissue, there's a good chance she has, this kind of density. But if a woman is relying on mammography to tell her what's going on and she has heterogeneously dense or extremely dense tissue, she better consider doing other screenings to give her the best picture of what's going on.
So Jessica is saying, what does it mean when a thermography result is in shades of green with a bit of yellow and orange in armpits? My images.
The armpits are always warm. So it's normal to see warmer colors in those areas because you're perspiring.
Mm-hmm.
And it makes sense. And actually the lateral breast, Magdalena, are always going to show some warmth there because this is where the lymph nodes are located, right?
Yeah.
So the lymph nodes are, if it's doing its work, you're going to show up a little heat because the lymph nodes are doing their job.
Yeah. There's questions about thermography clinics in the UK. I guess the answer is just Google.
Yes, that would be what I would do because I'm not familiar with how Europe accepts this.
Yeah.
To be honest, do you know anything, Magdalena?
I don't.
Yeah, I don't either.
Let's move on to the next question. Kim is saying, I'm having thermography done on March 24th. Is there something I need to be aware of? I also have implants and I feel like I've had issues with them, but MRI, sonograms, and mammograms haven't showed anything.
Okay. The thing with implants, whether they're saline or silicone, they are cooler than human tissue because they're man-made material and they show up cooler. They should show up. So we look at thermograms of women with breast implants differently because any amount of temperature difference in one breast versus another, even if it doesn't exceed what we consider a normal temperature difference, is going to get our attention because the implants make the breast cooler and we don't want to see any heat. So if a woman with saline or silicone implants sees any heat within the breast tissue, and they're aging implants, they've been in there for a while, this might give her an indication in the case of saline that there could be leakage. In the case of silicone, that it's worn down into the tissue to the point where it's caused some inflammation.
There's questions about who Dr. Rind, so R-I-N-D. Do you want to tell them a little bit about Dr.
Yes.
Rind and where he practices?
Absolutely.
Mhm.
Dr. Bruce Rind, it's spelled R-I-N-D, which is rind, but it's pronounced Rind. And he's in Gaithersburg, Maryland, at the Center for Health and Healing. He's been practicing functionally for 45 years, and he definitely truly is a pioneer in breast thermography. So, but he works with people with many challenging health issues because of his years of experience in working with all kinds of challenging health issues. People go to him from all over for neurological problems, autoimmune, all the many things that are plaguing people today as far as their health in this world. He's dealing with tough issues, but he is definitely a pioneer in breast thermography. And
I also want to mention about him because he's an interesting person for sure, and so he still is in practice, which is becoming more of a rare thing, especially due to COVID. And so for those of you who are in Maryland, you can easily go and see him as well. One of the cool things is he's an osteopath as well.
Yes.
Which means that he can adjust you. For example, the spot that you saw on my chest, right? The red zone there.
Right.
That's because I have there's basically it's a structural thing in my rib cage, right? And so my ribs are much more pronounced on one side of my chest compared to other. Scoliosis is basically due to scoliosis. If I had it doesn't bother me, so I've just never really proactively addressed it. But Dr. Rin shows in his when I interviewed him, he showed me images, you guys, of like women who had congestion because of structural changes. And just by him doing a simple manipulation adjustment, he will take the photo 20 minutes later and he's just like, everything is just resolved. Like everything is just looking symmetrical. There's a lot more coolness in the breast. The other thing that I want to mention that was really fascinating is that he has much appreciation, maybe not to the degree that Gay and I do for food and nutrition, but he still appreciates it and he's on top of it. He has images that he showed me of a woman who came to his practice and having coffee prior to her scan.
Mm-hmm.
And all her breasts looked like, she looked like a leopard. I mean, it was so blotchy, right? So again, is the grayscale contrast that will show you your degree of estrogen dominance. And then he will ask her, and then he will take the scan like 40 minutes later when she metabolized that coffee, right? And the breasts look a lot better already. So it's such a reminder that, the role of estrogen dominance in your breast health, that's part of the reason why. Actually, somebody was asking just now, what is who wrote the book about who wrote the book about estrogen dominance? Well, actually, that's me. It's called Overcoming Estrogen Dominance. You can get it on Amazon. And one of the, there's a whole chapter on breast health because of that, right?
Right.
So profound changes can happen pretty quickly. And this is the preventative stuff we're talking about. So you don't ever have to find, irregularity on your breast that they send you for, give you an emotional meltdown, right? Of like, what is this? Is this breast cancer? How do I get this diagnosed? And just take care of your breast as quickly as possible, as soon as possible. There's another one. This is a good one here for you. Okay. My thermography showed I had blocked lymph nodes. I have severe pain in my left breast. Any tips on protocol?
What was the first sentence you said about her?
And my thermography showed I had blocked lymph nodes.
Okay.
I have severe pain in my left breast. Any tips on protocol?
Oh, well, that's lymphatic congestion.
Right.
So yes, learning how to do a proper breast massage regularly is going to help quite a bit.
Rosie, this is the one, if you have, it's on our website everywhere. Learn how to do, this is the method that I've learned from Gay. And she learned it from Dr. Rin on how to massage your breast. So it all is specifically mentioned there. And, for product, consider getting Happy Sisters. We've got poke root, St. John's wort, Nigella sativa oil, castor oil in here, ginger, to warm up your breast and move the lymphatic system a lot better, right? So this is a very thoughtfully put formula together. One of my good friends has 3 kids, and she's been having a blocked nodule on her breast for years and causing a lot of sensitivity in one of her breasts after her 3rd child. And she said that, again, because it wasn't like really bothering her so much, it was just uncomfortable. But, same as me, right? Like, we have these imperfections in our bodies and we prioritize maybe our activities in a day, and I just don't pay attention to that kind of stuff. That was her too. And I sent her Happy Sisters, and she said this is the first time in years that she actually has no more pain in her breast. So that stuff really works, and especially when you massage it the way we've got the instructions presenting it there.
Absolutely. Those 2 things alone are going to make a huge difference.
There's questions, you guys, about different places thermography. I mean, we wouldn't know places in every, United States is a very big place. Google it and use the criteria that we mentioned, on what are the things that you need to ask them in order to qualify, that it qualifies in your own mind. So let's just repeat this one more time. So you mentioned preparation before. Right. So call them up and ask them how do they prepare you, right? You want to you want to be in a cool room. They want to cool down your body, correct?
Make sure, that you can't come off the street drinking coffee and do this. You can't come in and do this after it's 100 degrees outside. You can't. If that's the case, they're not following the protocols that need to be followed to properly acclimate you before you arrive, and then the center should also acclimate you in a cold room. If they don't have a cold room, that's an indicator that they're not following protocols as well. So you just can't come off the street and do this. You just can't.
Yeah. And they should tell you also, please don't drink coffee or alcohol prior to coming, right? That's like another, a really good one. And then you want to make sure that it's in color and in grayscale. You want to call them up and find out what the camera detection is like.
Right.
So I dropped the the pixel range.
Right.
Because now
who interprets that, how much experience we have.
Exactly. And just use your intuition. Really, your intuition is actually telling you a lot more than I think we give it credit for, and let me give an example. This is not about thermography. Thermography, that let me put it this way. When I found a thermographer here in Boulder, Colorado, I looked at her website. I'm just like, boom! I know this is the best place I can find, for thermography. And she is 100% in it, and she makes dietary recommendations, supplement recommendations, lifestyle recommendations. She's 100% in it. And fair enough, it was a great experience. On the other hand, let me give you an example of something that, this was like 6 years ago. I had problems with my hips, and I really did not want to get a surgery. I didn't want to get a double hip replacement because back then I was, like 45 years old, and it's like, man, I'm kind of young for that. But at the same time, I was in debilitating pain, and so I was looking at a lot of different alternatives. So I found stem cells. And, and I was going to go up to this clinic in Seattle to get the stem cells done. And I started having nightmares about it. I never have nightmares. I'm not a fearful person. Like, in fact, if anything, I was excited about the stem cells, and It was $10,000 per leg. It was very expensive. Insurance doesn't cover it, right? And supposedly great results and whatnot. It was something was screaming inside me, and I called her and I canceled it. And later I found out that actually for hips, stem cells don't really make that much of a difference. And so, and there's still very little research and actual procedures done. Stem cells work a lot of other things, but not on hips. And so, it was my own intuition that I deployed, that I called and canceled. And I ended up doing a double hip replacement, which was a very good decision to make. It's given me my life back. But don't forget your intuition. That's really, really important. Let's do one more question before we wrap up. There was another one that I just saw. Okay, let's talk about iodine, because that's a really good question as well. Mm-hmm. Also, is the iodine massage oil blend good for breast health?
Well, you and I both know, Magdalena, what the answer to that is. Iodine is needed for breast health. Dr. Wren told me years ago when he was training me that 2 organs in the body need iodine. That would be the thyroid and the breast. So absolutely, it kills bad cells. It helps improve lymphatic congestion. Iodine is needed for breast health. It promotes the apoptosis, which is the programmed death of cells and bad cells and normal cells. But it's very important for breast health. And it can't be, I do not promote it, and I don't know how you handle this, Magdalena, but Dr. Wren has told me if someone is in autoimmune, like Hashimoto's or Graves', or even hyperthyroidism, you have to be really careful about supplemental iodine, whether it's topical application or oral.
Yeah, absolutely. That's the only precaution really with iodine. And I personally don't touch iodine because of my history of Hashimoto's. Mm-hmm. And so, yes, so that's the short of it. Let's do one more question, because I think that's a really important one. Julie is saying, do breasts change with menopause?
Yes, hormonally, they do, Magdalena. Definitely. I mean,
Julie's asking, so answer Julie, not me.
Okay. I can't see anybody, so I just see my slide presentation, and that's about all I see. So
let me remove that.
Yes, as you enter perimenopause or menopause, your breasts are going to change because your hormones are changing. And a lot of times, because of the flux of hormones, it's going to show up in the thermal images. And you may be more cystic. And a lot of people around their period are more cystic, and a lot of women are more cystic when their hormones are in flux. Would you agree, Magdalena?
Yeah, absolutely. So there's a few things in here, and I'm glad, Julie, you asked that question, because we think like we go into menopause, our breasts start drooping, right? But that's not really just the only change. There's so many other things happen. Number one is our sensitivity to insulin is significantly reduced, right? So that's part of the reason when we put on weight. We put on weight around our tummy. It's almost like we are going closer towards insulin resistance when we get older, and that's normal because your cells are just not as able to receive insulin and clear sugar out of the bloodstream, and you're much more sensitive to blood sugar imbalances as we age as compared to before. Now that can cause inflammation, right? That can cause DNA damage to the cells, right? So that's something we need to be aware of. The other thing is that happens with menopause, which is a big shocker for a lot of women, and I plan to talk a lot more about that, is that, when we think about estrogen dominance, we think about young women who are dominant in estrogen, so they have a lot of estrogen, right? But as we go into menopause, our estrogen starts dropping, so there's no way you're going to be dominant. My colleague's mom, who's highly estrogen dominant and has a history of breast cancer and ovarian cancer, picked up this book, which was lying on her kitchen counter. She picked it up and she's like, "Oh, Overcoming Estrogen Dominance, nice book." And she put it back down. And my colleague says to her mom, "This book, you need this book." And she's like, "No, I don't. I'm in menopause. I don't have estrogen dominance." Right? No, because, you think like if your estrogen is dropping, you don't. And that's one of the biggest misconceptions. You guys, in fact, women in menopause have as much, if not more, estrogen dominant issues as compared to younger women. because of how you metabolize estrogen.
Mhm.
And think of it this way, right? I can explain this in just a second, what the mechanics behind it is, but think of it this way. You know, women who have breast cancer, estrogen receptor positive breast cancer, we get that age 55 upwards, right? And that's because of estrogen dominance. Estrogen dominance is a fueling element component to breast cancer. If you were not estrogen dominant, you wouldn't be getting it, right? So, you know, it's a really important reminder. Now, why does it happen? How can you be estrogen dominant when you have low estrogen? It's really as simple as that. You know, estrogen dominance, think of it as like a river, right? A river flows. There's a bank in the middle of a river. That bank separates the stream to clean stream and a dirty stream. In other words, clean estrogens, dirty estrogens. And that bank in the middle of that river, that's your liver and your gut. Okay.
Mhm. Right.
As we get older, our liver is not as efficient. Our gut health is not as, you know, as healthy a lot of the time as it was in our 30s or 40s. And so what happens is when you're in menopause, instead of having like this big river that I'm talking about, now you have a stream. And that stream is just less water in it. But the stream still goes through a bank, and that bank still separates it to a clean and a dirty estrogens. So it's there. It is there. The other thing that happens with estrogen dominance is not just the separation of clean and dirty metabolites, but it's also the progesterone to estrogen ratio.
Absolutely.
Okay. And as some of you may know, after 45, your progesterone goes boom. Estrogen also goes down, but not as quickly as progesterone. Progesterone really drops fast. And so the difference between progesterone and estrogen, as much as they were like somewhere okay in your 20s, 30s, 40, 45, they're like progesterone is really dropping quickly. Estrogen is dropping a little bit, but progesterone is dropping really fast. So the difference between them becomes pronounced. And so supplementing, for example, with progesterone can also help your breast help.
Yes.
And
Yes.
you can apply. We're going to be talking about progesterone starting next week. One of the things I'm going to teach you is how to apply progesterone to get different results out of it. But you can also apply progesterone on your breast.
Right.
Because it is fat tissue, is going to give you slow release of progesterone. This is your thin skin points, right? Your neck, behind your neck, on top of your feet, etc. That's a fast release progesterone action. So you can put that on your breast very easily as well to get the results.
One last thing about that. What causes our progesterone to lower at any time? Stress. And we haven't even mentioned that word yet. But when you're producing cortisol and adrenaline, you're not producing the progesterone that you need.
Yeah, totally. And stress doesn't have to just be emotional stress. It can also be physical stress,
right?
Over exercising, physical. Yep. It can be also chemical. Yep. If you are in a polluted environment, your body is actually working extra hard to try to detox you from everything. So, I feel like every time I come from a city, like I love going, to LA and New York and have fun with my friends and do conferences but then when I come back, I just feel so depleted, and I feel like my body just needs to rejuvenate and kind of get the vital energy back in my body. And so it's a form of stress as well.
It is.
Just to travel and big cities and pollutions.
Absolutely.
Thank you so much, Gay, for being here today.
Oh, Magdalena, thank you for having me again. I'm delighted.
And so everyone, Gay Walden from holistichealthbreath.com, is that correct?
Holisticbreasthealth.com. Visit my website, reach out to me. You can email me, call me. I'm here as a resource for you. Even if you're in another part of the country, I'll do my best to guide and help you through this part of your health. I've learned a lot from 10 years of doing it and from Dr. Wren, and I'm wanting to share. So thank you very much for your attention, and thank you, Magdalena.
I hope everybody found this helpful somehow, and it helped you understand what to look for when you're scheduling a thermography appointment in your area. What are the things to ask to be an educated patient, and also the whole understanding the difference between mammograms. And I hope this is clear today from those of you who attended. and watched is that thermography and mammograms are completely two different technologies with a different purpose. Those are not interchangeable as such. They show you a completely different story, and so you have a lot more clarity on that as well. All right.
Thank you so much, everyone. Thank you, Magdalena.
Thanks, everyone,
Take
and I'll
care.
see you next week. Bye-bye.
Bye.